So I'm just going to very briefly go over who's a caregiver, a carer, or a care partner, overall experiences of family members of people living with Parkinson's disease. We're going to talk about stress and then ways to manage that stress, and very practical ways to manage the stress. I always start with this introduction. I have a real problem when people talk about your spouse, your father. Can I have a show of hands? How many people are here because they're partners of somebody with Parkinson's? And how many people, children, adult children? Okay. So when I talk, I'm mostly going to say your partners because of the majority, but keep in mind that what I say goes for all family caregivers or family of choice. One thing you will not ever hear me say is your loved one. I have a real problem with this. Healthcare professionals tell you constantly, oh, your loved one and your loved one. And I know, and we all know, that sometimes the person we care for, they're not our loved one. We do this out of duty. We do this for many, many reasons. And I'm not saying that we may not love them. Sometimes. But the problem is when us healthcare professionals call your family members your loved one, we're not giving you an opportunity to speak your truth. We're already shutting you down and passing judgment on your relationship. So I hope that you, when you go see your healthcare providers, your friends, and in your communities, you educate people about what a loaded concept it is to talk about the person with Parkinson's as your loved one. And again, it's not either or. It's just it shouldn't be the only term that we use. There's a lot of literature around the language is changing. We don't use caregiving as much because it implies a unidirectional relationship. We give, the person, I guess, receives. And we know that this is not true. These are mutual relationships, and we may give some form of care, but the person that we're looking after gives us a different kind of care sometimes. So carer is a more neutral term. Some people like care partners. I use a lot the word caregiver, mostly because I've been doing this for so long and it's the language I'm used to. I'm trying to change it. But when I say caregiver, I don't want you to think that I'm only meaning it in the one unidirectional way. It's just, I'm used to it. But please feel free to adapt the language to something that is meaningful to you. I love this quote from Rosalynn Carter. There are only 4 kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. And it is so true. And if any of you have a lot of time and want to find a great website, the Rosalynn Carter website has a lot of interesting information for carers, a lot of evidence-based, a lot of research on it, a lot of types of groups that exist in the world. So I think you'd find it really interesting. I just briefly want to say very few things about what the literature says, but the only reason I want to bring this up is to see if your experience is similar to that of what the research says, okay? So research says that motor symptoms have the strongest relationship with caregiver distress because as people become more dependent, the higher the physical symptoms, the more they need you. Does that resonate with you? So I'm raising this because this is exactly what a lot of the other researchers say, that for as many people that say that the more physical problems that exist, the more difficult the situation, You will have people that will feel that perhaps the mood changes, some of the personality changes. Say that again? Yeah, some cognitive changes are more problematic. Yeah. Okay. So I'm saying all of this because you need to be aware that when you read things, when people tell you things, your experience of your own situation matters, and it's reflected also in the research, sometimes. Depression is a biggie one. So if your partner has depression, you're more likely to be depressed, and vice versa. The more advanced the disease is, the more difficult it is for the carer. And there's this hypothesis of the wear and tear hypothesis. So if I've been doing something difficult that's stressful for 20 years, 10 years, I am more tired than if I just started 2 years ago. However, people adapt. All of us are human, and somehow we fumble, muddle through things and adapt to whatever our life brings. So some people in the later stages actually find that it gets a bit easier because they've learned what they can deal with, they know what supports are available, and they find the earlier stages when everything's new and different to be the most difficult time. So again, it varies. And as I said before, cognitive changes are really, really difficult for partners to deal with. Again, when you look at the literature, there are 4 themes that carers, especially spouses, find are issues for them. And let's see if these resonate with you. That you feel that you need to carry on as usual, and there's always that tension that you must carry on with your life, yet at the same time, life is not the same. Does that resonate with you? Yeah. The second one, the importance of support to help you cope. And that is mixed. So some people love support groups, feel this is the best thing. They call it a lifeline. Other people really, they've gone to one support group. They heard people that are ahead of them in their journey, what's going to happen, and they don't ever want to go again. That's you. So again, it's not one size fits all for people. It's generally different supports are good for different people at different times in the journey. So don't let anybody tell you you must go to a support group, it'll help you. It helps a lot of people, not everybody. But by support, I also mean the support of your family, your friends, your church, your community, your place of employment. So support can look very different. The other theme that spouses talk about is this constant balance between your caregiving duties and your own needs. And it's always a struggle between the two. And the last theme is finding information. Some people feel that at the time of the diagnosis, they did not get enough information, and that they could have used a lot more knowledge from the physician, from the team, things to expect, things you didn't know, like there could be psychotic features that nobody's told you, and the first time they appeared, you're like, what's this? Other people find that knowledge is not good for them. They prefer to discover things. As symptoms come, they like to learn about it at that point. Again, don't let any healthcare professional tell you, I must give you education and tell you what's ahead. If you're not prepared for that, it's okay for you to say, I understand that you think it's important for me to have education. Right now, I can't deal with that, or I'm not prepared for that. But thank you. I will come to you when I want more information. Google, Dr. Google, big problem for some people. You start learning all about things that you've never heard before that may or may not be true. And so now you have all these ideas and worries and concerns that may or may not be factual. It's always the Parkinson Society is a good website to go to. I would go to a recommended website as opposed to just Reddit or wherever else that people go. I mean, I don't even know where people go to, but please use well-known websites for your information. Very important. I was hearing before around this whole idea of feeling isolated. For partners, feeling included in life, that concept changes with the onset of Parkinson's disease. A lot of the times there's a lack of understanding from family and friends. They feel like, so what's wrong? He shakes a little bit. How does that affect anything? People don't get it. For the most part, they don't. And you get tired of explaining how it impacts you. And this is why I called this presentation The Invisible Patient, the carer, because nobody asks you, how are you doing for the most part? You go anywhere and everybody asks you or asks your partner how they are. And you're sitting there like, you're just fine, you don't have this illness, nothing wrong with you, and you can't complain because you're fine. But you're not fine. And so people tend to become isolated over time. It just becomes more difficult to do social things. You're tired of explaining yourself sometimes, and so it's just not worth it. It's also important to maintain some independence. Time away is crucial. And you know it, I know it, but it's hard to do in real life. I mean, the fact that you're all here today is fantastic. So I wouldn't be as worried about this group as opposed to all those people that are at home and they're not going anywhere. So it's great that you've somehow managed to come to a place like this. This is like a giant support group for all of you, so it's wonderful. So try not to become too isolated. The other thing that we find is that there are few or less meaningful couple activities. So things that as a couple you used to do together now are becoming more difficult. And even though you do them, you don't have the joy or you don't find it so meaningful. So it's important to try to maintain some things that give you as a couple or as a family something normal that you would have done in the past. What are some examples of that? Does anybody? Yeah. Say that again? Going out for dinner somewhere. Do you find that that's more difficult now? Yeah. Going to the theater. Yeah. Traveling.
Going to the movie.
Going to the movies. Yeah. Are there ways that you can make these activities happen? Yeah. Yeah.
If you try and find a restaurant that isn't too noisy.
Okay, good.
Do you find a restaurant that isn't too noisy?
That's good.
And what my husband and I do is always try and sit side by side now,
Okay.
instead of across. because now I can hear him, we can talk, I can cut his meat up, I can share things with him.
Great.
So,
Okay. Yeah.
Coming. Wheel
Wheel-trans,
trans.
great.
You can go with friends and let them know what kind of support you need. But if you're going to go just as a couple, you can phone the restaurant ahead of time, let them know you're coming, and let them know that you would appreciate some support so that they're prepared.
Great points. I used to have a few of the couples I worked with, they do their own dinner parties in each other's homes, because then everybody understood and it was easier. And we had people that met through support groups at Baycrest that would do this. Yeah.
A lot of areas have ProBus for seniors and that. It's a group of seniors that go on excursions and that.
Okay, great.
And we just joined one ourselves together. So.
Oh, that's good. That's great. And there was a question around there.
One of the challenges as we age is staying out of touch with technology. And there is so much technology now that can help us with partners whose voices are low,
Yeah.
where our hearing isn't working all that well. And recently, my husband and I got hearing aids, but we also got these little microphones.
Okay.
So now we go to a restaurant, and you don't have to get hearing aids to do it. The technology exists. His voice is amplified into my ear, but not the background noise. So one of the things that's really useful is to talk to your kids about what technology is out there that can help us hear each other better.
Great point. And this is changing daily. The technology is available to support people, so really important. We at Bakers, we're doing a lot of work on this, actually. Yeah.
Apologies in advance if this offends anybody, but my husband and I try to use a bit of humor, and we've noticed, he doesn't feel it so much, but I see it. With Parkinson's, you get more of the saliva in the mouth and you get the jaw going like crazy. So, and we laugh about this, but when we go out, he's not allowed to order spaghetti anymore. But we have that dialogue, we have that discussion about it. It helps a lot.
But humor is huge, huge. Goes a long way. But you have to have the relationship to be able to use humor, right? Yeah. This is the other thing about relationships and couples where if one person's affected by Parkinson's disease, and we know that people that had good relationships for years before, it's easier for the carer to adjust and adapt to it. People that had horrible relationships before, sometimes people start finding some positives with the changes. People that had ambivalent relationships before have the worst time with the changes, because this is the icing on the cake. Things are unpredictable. They were unpredictable before. They are unpredictable now in a different way. So there's nothing you can do about your past relationships. But things in relationships can shift due to the illness. And you'd be surprised how many people talk about things becoming more positive for them, or finding something new about their partner that they didn't see before. So it's not all terrible for everybody. And it's as a social worker, is one of the first questions I would ask is about the past relationship. The same goes for adult children. If you had a close relationship with your parent and it was a loving relationship, it's hard emotionally, but it's easier to do it. If we are doing it out of duty, we had an ambivalent relationship with our mother, and now this, again, is the icing on the cake, that is going to be a lot harder to be a carer to that person. So even though you can't do anything about the past, being aware how your relationship was and is makes a difference. It gives you insight. Another common thing is that family and friends, it feels, and sometimes it doesn't just feel, it's reality, that they are not there for you or your partner the way they used to be. There's this idea, contagion, like some people are going to get Parkinson's, or it's too painful for them to see you as a couple doing things because it could have been them. And there's multiple reasons why people stop the relationships. It's very difficult to ask for help and to say something about it. But if you have the closeness, it's worthwhile asking or saying something. Because people are very happy to just very quietly leave your life. And if you say something, they're likely to say, I don't want to bother you, I know you're so busy, I didn't want to ask you. Let people be aware that you're very comfortable with them asking you out, asking you to come and visit. And it's no different with family sometimes, siblings in particular. I had a client who was really upset. She called me once because her twin sister was going on and on how difficult it was for her. She was traveling through Europe and the packing she had to do. And I was going on and on about how she had to get euros. And she was devastated because she felt, how insensitive can she be? How is this such a struggle to have to go to the bank to get euros? You know, so then we tend to, and she was very upset because this was her twin sister, so they were very close. So a lot of our discussion was around trying to, how would she talk to her sister, doing some role play in a way that it wasn't calling her names and say, how dare you, and just yelling and alienating her sister even more, but in a way that would be productive. Something like, I'm so happy you're going to Europe with Bill. Put yourself in my shoes for a little moment. It's hard for me to hear how you're making these plans, not because I'm not happy for you, but because I'm feeling bad for me. People will listen to that because you're making yourself vulnerable. You're explaining exactly what's going on. You're not reacting and yelling and saying, get out of my life, you insensitive little whatever. In a conversation when you can say how it's affecting you, you're not blaming the other person. You're just saying, this is how it makes me feel when you tell me how hard it is to get euros at the bank. Right? So it's important for us to learn how to shift conversations. It takes time. But if we don't do it, the other people are not motivated to do it. Yeah.
The point you're making, I'll share this with you, that, and I've lectured on this topic myself. When people like to hear their own voice, so I used to not try to interrupt them because they like to hear their own voice, but the last year, and this is for myself, I just stopped them. And I say the following, and you all like quotes, so I'll give you the quote that I use. There's two types of people on earth. The first one will listen to respond, and there's the other person that listens to understand. Which one are you? And it stops them cold. Yeah. Listening to respond or listening to understand.
So Sam, we're going to take this a bit further. When you say that, people stop, and how do you think they feel?
That's why I say I never used to table it. I don't sidestep it because it leaves me frustrated, and right now I just say it. I don't. And you know what? When you say it, you feel better. They probably don't understand, but when you table it, it's weight off your back because you build up frustration, and it's the reason why you're talking to them is to release that frustration, and it builds even more when people don't listen.
So I'm just going to take it a bit further. And so you think you feel good because you spoke your mind. The person feels insulted or feels, or even worse, it's not insulted. They feel, I'm a horrible person. I am so unempathetic. I am so off the mark. Nice seeing you. I'm off to have my coffee by myself because I don't want to engage because now I've insulted you and I feel bad about myself. At the end of the day, it takes a big person to say, oh my God, Sam, you are so absolutely right. I hear what you're saying. Let me change the tone of my conversation. How many people say that to you? Oh, yeah.
Actually, at first they'll stop, you're right. But the reason why I'm telling them is that you're looking for help. And the stress level when they're not listening elevates. And for me, that's weight that I don't need. And I'm sorry I called. But what's interesting is some people get it and they'll change for once, for twice. The third time, it's back to reality for them because they don't want to go there. And a lot of times they don't listen because they don't want to go there. They all know, but they don't want to go there because it's scary.
So, thank you for sharing that. So, what's important for us, for this group, is to learn what kind of person we are. And when we're in relationships or talking with people, some of us want to speak our mind and say, you know, I can't take it. Like in a nice way, like using a quote. That's one way to do it, but there's different ways to do it. The goal at the end, and you have to be the big person, even though you're stressed, you have everything on your shoulders. But if you don't want to be alienated, if you want people to continue being there for you, it takes work, unfortunately. And it defies logic, because you would think that people would know, I'm going through a hard time. Why should I have to work so hard to try to engage in a conversation with you or to engage your support? It should be the other way around. The person should be trying really hard to engage us. But that's not the way of the world. So whichever way you can, and you know how to, also when you're feeling up to it, because a lot of, I say all this, you should hear me at home sometimes. These words come to me in my office only. When I'm in my own personal life, I'm not quite so wise, So say, get that out of here and leave me alone. That's more like the Adriana if I were in your shoes, right? So, but I know the other piece of me. So when I'm in more control of my emotions, I can say things that help people be closer to me. Okay? And if we had time, we would practice that. But that's a skill that I want you to be mindful of. Oh, the other thing I don't want to forget is a big change is financial support. And you can't underestimate for some of you, for some people, how impactful this is. I mean, the person, your partner may not be able to work anymore and may not have a pension plan, and depending what your age is, and if you're under 65, and you lose your job, your business, you don't have anything, this is huge, a huge problem. If you're over 65, it's a little bit easier. Those that start with the illness or there's an impact under 65, or you as a carer have to cut back on your job or quit your job or take early retirement. So this is a really important factor as well. And we're not, in Canada, we're not even close to having the supports that Europe has. The UK, Australia, and some of those countries. So the emotional impact of being a carer is generally distress, depression, anxiety, and guilt. I heard that you were talking about this before. Guilt is a lot of people's middle name, unfortunately, and it's something you need to work through it. Not easy to do, easier said than done. The other problem that people have is you become more focused on caring for the person, for your partner than yourself. That's a recipe for disaster. And there's a physical impact. So we know that caregivers are at higher risk of death, never mind just illness, than non-caregivers. It is that bad for you in terms of stress and physical changes. In men, it tends to be associated more with metabolic disease, like increased blood pressure, diabetes, cholesterol. Women, it tends to be more depression and anxiety. They both kill. Depression and anxiety and metabolic illness. But in spite of all these negative things, there are some positive perspectives. It's not, a lot of people will talk about finding meaning, and it depends on the trajectory, right? So people that have been doing it for a long time and are able, some people find meaning, through the difficult times, like they find that they've become more patient people. They find that they're becoming more loving people. They find that there's the benefit that now they've gone to a church or somewhere and they've met new people. They've gone to a support group and met a new group of friends. Yeah. Yeah, go ahead. Say. Oh, no, it's okay. So it's this idea that there, and we also know that people that are optimistic, and we know this, there's great research on this from Harvard, this longitudinal study that's been going on since I think their 30s, that optimists just manage better. People that see the glass is half full, always through any difficult situation in life, whether it's caregiving or loss, anything, do better. And the good news is we can teach people how to be optimistic. It's not an innate trait, as we used to think. So this is very hopeful, because we can do some self-talk around. I had a client, so his wife became incontinent, and he had to change her briefs, and he was devastated by this. But he said to me, you know what? I just look at it. I'm so happy she's eating. It's food in, food out. Or somebody else who became a singer. She started singing nonstop. And this is somebody that had an atypical type of dementia. And he said, she must be so happy. She's always singing. Other people would be like, oh my God, she's driving me crazy. And it's a kind of shifting your perspective sometimes. The problem's not going to go away. But how you view it or you see it may help you feel better about a situation. Sorry, yeah.
I hope you're going to say some more on this second phrase there, but I just want to comment to make sure that we can talk about it a bit more. Caring for a relative, more important.
Yeah. I have another one, but if you can just turn that one off so we don't get the feedback.
Caring for a relative more important than caring for self is a phrase that helps me see red a lot of the time.
Oh, yeah.
Because it's such a high-level statement, and I know that in a great many situations with Parkinson's, caring for a relative requires so much time and effort that there's no way you can find time to care for yourself or any kind of meaningful caring for self. And are you going to speak more about how to
Yes.
change that?
Yes.
Please.
So, so maybe I'm going to shift to, we're going to talk about caring for yourself because, this is a big issue. All the professionals tell us, you should take care of yourself. Well, if they were only in my shoes, if people only understood, that's easier said than done. And it is easier said than done, but there are some ways that people can do to love themselves a bit more. I'm not going to talk about that. Okay. So, before we know what stress is and what looking after ourselves looks like, we have to know when we say we're people, a lot of the times people that are stressed don't even know that they're stressed. And so any of these symptoms are signs of stress. So shortness of breath, knot in your throat, stomach cramps, chest pains, headaches, compulsive eating, too much alcohol, increased smoking, being irritable and not having patience, and just a desire to strike out. These are all typical examples of stress. And you can't do anything unless you're aware that these are symptoms. Overwhelming stress. So people will say, how are you doing? Are you or you go to a physician, a social worker, and you ask, are you stressed, depressed? And they go, oh, no, I'm just fine. Because people have this idea that depression is only being in bed, not being able to get out, not eating, and doing nothing. And that's not necessarily true. There are a lot of people that are functioning quite well and are still clinically depressed. So this idea of having sorrow, sadness, to the point that you can't make decisions, everything becomes overwhelming, even the smallest things. Chores are delayed. Not being able to, you're confused, you doubt everything you do, you're feeling helpless and hopeless. You put relationships and things you used to enjoy on hold. More conflict with your partner, with your children. Stepchildren, I could have a whole half-day discussion on stepchildren and how that affects couples and who does what, and also people's siblings. And if you find that you're getting into more fights or the opposite, you're just more disengaged, these are signs of stress. Feeling isolated and just being anxious and depressed. So now we're going to talk about coping strategies of dealing with stress, and part of dealing with stress is caring for oneself, because the best way to care for yourself is dealing with stress. And I like this slide because it's a tunnel, and we've all heard this, but it is so true. The only way out of something is through it. You cannot escape your life. You can go with Bill to Europe and get your Europe and your sister. But you can't, your life follows you because we are our lives, right? So we need to learn to deal with our issues. And I'm going to talk about 4 different techniques today. Asking for help, dealing with uncomfortable feelings, self-talk, and both and thinking. Okay, so we're going to spend time with each one of them. Asking for help. How many people find it okay to ask others for what they need? Yes, go ahead, Linda.
Oh, I thought you were asking this.
Okay. Only one person finds it. Okay. No, okay. So it's very hard to ask for help for a lot of us. And we may change over time, but initially it's very hard. And we feel like we must do it all ourselves. A typical comment is, I don't want to ask my son. He's so busy. He works full time. He has a family of his own. It's okay. I'll do it myself. It's okay. I don't want to ask my sister. She's busy traveling to Europe. I can do it myself. Other people feel like even if you were to ask, people are going to say no. And nothing worse than feeling rejected. So better not to say or to ask. Other people feel that it's not okay to leave your relative with someone else, that you must do all the care. It is okay to leave your relative with somebody else. You do not have to do all the care. There's no such rule. And the other is the reality of is, it's hard to, sometimes you have to pay somebody. And it's expensive, and those people are not available. And when they're available, they're only a minimum of 4 hours, and it's $25 an hour, and before you know it, it's like, it's too much money, it's not worth the trouble. Find ways to ask for help. Find your allies, even if it's one or two, that you could say something to. And I'm going to generalize, but it's a true generalization. If you have a son and a daughter, don't always ask your daughter. It's okay to ask your son as well for help. Because this is the typical thing I hear from when I see adult daughters that are caregivers. Everything's on me. I'm the daughter. My brother's off to Europe. I'm here. I can't go anywhere. So in families, there are always rules. Rules don't have to stay the same. Rules can change over time. If in your family, the rule is that you do everything yourself, and your children are busy going everywhere, and they're busy with their children, and they're busy working, and you're expected to do it all, you can change that rule and say, I'm feeling that I have a lot on my shoulders. Would it be okay if Sunday or whatever day you have some time, you can come for 2 hours to look after your dad while I go fill in the blanks? You can ask people to help you with meal preparation. Or sometimes it's you don't want the break yourself, but you want somebody to go spend time with your partner so that you can just go read your book or watch TV or do whatever you want to do. Find something that you think would be meaningful to you. What kind of help would make sense to you? There's also lots of support groups. Now, I know at Bakers we're having virtual groups. So they're synchronous. So we have a social worker at the office with a laptop and a video camera. And everybody links in from their home or we had somebody from Home Depot parking lot because it was free Wi-Fi. So on their phone. So the technology is there that you could do. And we've done research to know that as much as people say, oh, no, I prefer a face-to-face, it's better, a lot of people get just as much benefit from the virtual groups. And for some people, it's the only way they can participate in the group because they couldn't attend. They can't leave the person by themselves or they're busy working. We have some groups at lunchtime, so people that are working from 12 to 1 could log on perhaps from their desk. We have some at 5:30 in the evening because right after work, people sometimes stay there at work because they have some peace and quiet. And we just had a group a couple nights ago. Somebody in Portugal, she's traveling, so this allows her not to miss her group. It was like 10:30, I don't know what, it was pretty late there for her. But here she was walking around the streets of Portugal with her phone, participating in the group. So that may be something that may work for you and your lifestyle or for your children. And the one thing I want to say is the needs are very different. For spousal caregivers, what you go through on your issues are totally different than what adult children go through. And so we don't like to lump everybody together in one support group because it's different. You can all be carers, and yet the needs be so different. So we try to have groups that are especially for partners and groups that are especially for adult children. And if you don't know where to go for help, ask your doctor or ask your healthcare professional. Go to Baycrest. There's a general phone line, extension 2223, the Seniors Counseling and Referral Program. Just call and say, I'm dealing with this. Where can I get help, or group or something? Reach out. Okay, yeah.
This is a little bit different question, but it's still asking for help. My wife has a tendency not to table the issues when she's visiting her doctor. Yeah. So I try to go to each one. Yeah. And the last few have been stressful because I don't want to leave it. Yeah. She's perfect. That's how her answer is. Yeah. But she's not. Yeah. So I table it. Am I allowed to call her doctor before?
Of course.
And say I'm having these issues?
Yes.
But isn't that a privacy issue?
No. So let me tell you, when you want to communicate with a healthcare provider or the doctor, according to the legislation, unless your partner is incapable and you're the power of attorney, in which case they can communicate, they can't really share information with you. You sharing information with them is not against the law. They just can't tell you, but your wife, if your wife wouldn't want you to know. They can't give you medical information. But you're within your right, and they need this information from you because they know that whatever history they may be getting from your partner is not necessarily reality. So please, ahead of time, it's easier if you put it in writing because if you call somebody, they may be busy, they don't have time, or they forget. So just bring it. You can bring it the day before or send it. Sorry, there's one question here, and then I'll go back.
Just a comment on that. My wife's doctor actually had a form that allowed us to not only for her to communicate over the internet via email, but also for myself. Yeah. So I had to sign it, scan it, send it in, and then we are both allowed to. So
that's a different issue. It's the issue around email. Email is not confidential. When you send anything on email, it's like sending a postcard. It's open to anybody. So that release is to say, if any confidential information that the doctor shares with you or your wife gets out, your doctor's not liable.
Right.
So that's different than sharing information, the doctor sharing information with you about your wife's condition.
Okay.
Yeah.
But it also allows us to, my wife finds it more comfortable because she can ask questions in a comfortable environment.
Yeah.
Okay.
And we only have 5 minutes left, so
So back to my question. If I could call the doctor, but the fallout from that, if my wife finds out that I did that, from my perspective, I say, is it worth it because of the fallout that I'm going to get?
So that's $1 million question. And it's okay for you to say to the doctor, here are some of my concerns, issues. I don't want my wife to know that I've sent this to you because I'm worried about this. Then it's up to the doctor. I know some doctors I've worked with that are pretty sensitive and they get it. And then there's some doctors that just pull it out. Here, look what your husband gave me. So it's you have to know your team, the team that you're working with and the person you're dealing with. Sometimes. Yeah.
In the case where there is cognitive issues, I I now have to go to every appointment with him, but I'm the one telling him telling the doctor how he is.
Yeah.
Because when he says to him, he waffles around and doesn't say anything. So I think it is important to always be there and to be prepared. And I am the power of attorney, but we're doing it all in front of my husband anyway.
Yeah.
So.
So, like you said, when there are cognitive issues, you're the power of attorney. You can be a power of attorney, but if your partner doesn't have cognitive issues, you cannot use the power of attorney, because powers of attorney are only at the point that somebody becomes incapable, right? So, and I'm going to do one last thing. This is a really good skill to have, self-talk. We have a fancy term for this. We call it cognitive behavioral therapy, or CBT. But it's something we can all learn very quickly. So when you're feeling frustrated, you could tell yourself, instead of, oh my God, this is horrible, is saying, rephrasing it to, I'm doing the best I can. Being gentle with yourself. Being understanding with yourself. What I'm doing would be hard for anybody. It's not just you. I'm not perfect, and that's okay. I can't control all the things that happen. Sometimes I just need to do what works now. Even when I do everything I can think of, my spouse will still have problems because of the illness, not because of what I do. I will enjoy the moments when we can be peacefully together. I will get help from a counselor if caregiving becomes too much. So just give yourself reminders. It's like you have this little voice telling you things. As you're feeling something, change your perspective. Don't be so hard on yourself. Yeah. So I put the website. This is a great resource for everybody. It's the Family Caregiver Alliance. They have amazing, amazing information, all kinds of tips. They're practical. And the website is, it's right there. It's www.caregiver.org. But if you Google Family Caregiver Alliance,
No worries.
you will get to it. Fabulous. Tons of great resources, easy to follow suggestions. American. But I use them because they, to me, have the most thoughtful, practical, easy to follow advice of any website, really. And it's because there's a lot of them, but they're just dementia caregiving ones. This is just open to caregivers, so it's more inclusive, I find. And the last one I said is, I have a minute left, is practice both and thinking. So instead of either or. You can be both a caregiver and a person with your own needs. You're not just a caregiver. You can take care both of him and yourself. You can have feelings like, I both wish it was over and that my spouse could keep on living. And this is what's so conflictual, because most people have those feelings at the same time, and it's normal. It's normal to have this ambivalence and anger. Like, I just want him to die, and we don't want to tell people that we wish this because people are going to look at us funny or horrified. But at the same time, we want the person to be well and stable and to live. And it's not that we want our partner to die. We want our partner to be the way they used to be. We want our lives to be the way they used to be. And again, it's being able to live with this ambivalence of both and. You can have different feelings and thoughts all at once, and it's okay. You don't have to choose between one or the other. And on that, I'm going to finish because we're run out of time.